myself Mashal Arif. I'm a student of Osh International Medical University. Today my topic is citrazine. Citrazine anti-allergic drug that belong to a class of medication called second generation antihistamine. Citrazine works by blocking the natural chemical called histamine that gets secreted during an allergic reaction in the body. Citrazine, properly known as aliride, citrin, citrus, and formistrin, condition for which citrazine is prescribed. Uh, con- Citrazine is prescribed for the following condition: high fever, sneezing, red itching, and watery eyes, allergic like dust particles, symptoms of urticaria, swollen, red, and itching skin, pollen induced allergy, insect bite, food and drug allergic. Citrazine is used to treat the symptoms like inflammation of the lymph node in the neck region. Citrazine is available in the following condition like tablets, capsule, dispersible tablets, syringe, and oral drops. Citrazine is available in the following strength 5 mg and 10 mg. How do you take citrazine? Citrazine is available in oral prescription which can be taken by mouth with food to avoid an upset stomach. Tablets or capsule should be taken with sufficient quantity of water. Chewable tablets should be chewed before swallowing. Citrazine syrup should be taken with measuring cups or oral syringe provided. Never use kitchen spoon as possible. Measurements are not approached can result in low or excess. Adult dose like 5 to 10 mg once daily. The maximum dose is 10 mg once a day at night. The initial dose is 2.5. What are the common side effects of citrazine? And dizziness, headache, nausea, diarrhea, and dry mouth. Pain in the stomach, confusion, tiredness, sore throat, itching and sneezing, and running nose. Increase heart rate. Uh, what condition to be in citrazine taken? Citrazine may be interfering with allergy test and should be stopped before 3 days of taking the test to get approach result. Do not drive and operate heavy machinery as citrazine may impair mental alertness. Never take citrazine with other antihistamines or drugs that cause sleeping as it may be led to excessive dosage. And do not take in larger amount for longer period that recommended. Never take a double dose to make for the missed dose. If you think you have overdosed yourself, contact the emergency or poison control immediately. What should you not take citrazine? Citrazine allergy to citrazine or chemical related drugs, pregnancy and breastfeeding. Solution is
Myself Muhammad Hassan Suleiman and I am the student of Osh International Medical University. So today I am going to make a presentation on the topic of barbiturate poisoning. So actually what are barbiturates? These are seen as drugs, means these are sedative hypnotics. Sedative means a drug that subdues excitement and calms the subject without inducing sleep, through drowsiness may be produced. And hypnotics means a drug that induces and maintains the sleep, similar to normal arousable sleep. Barbiturates, there might be long acting, short acting, and ultra short acting. Long acting are phenobarbital, short acting are butabarbital, pentobarbital, and ultra short acting are thiopentane and methotrexate. Some benzodiazepines also hypnotic, anti-anxiety, and anticonvulsant. There is a little bit about barbiturate toxicity. So first, I will talk about the little bit uses of barbiturates, then mechanism of action, then adverse effects. So use of barbiturates, it can use in the treatment of insomnia, and phenobarbital for epilepsy, thiopentane for anesthesia, adjuvants in psychosomatic disorder, and preoperative sedation also in the treatment of seizure disorder also. And then mechanism of action, in mechanism of action, the barbiturates will enhance the GABA mediated chlorine currents and increases the duration of ionophore opening, and it will also prolongs the inhibitory actions of GABA. So what about the adverse effects of barbiturates? Residual depression after the main effect of drug has passed, paradoxical excitement, hypersensitivity reaction like localized swelling of eyelid, cheek, or lip, for example, and synergistic action also with ethanol and antihistamines. Barbiturates toxic effects. So there are some toxic effects of barbiturates like slurred speech, ataxia, lethargy, confusion, headache, CNS depression, shock. Pupils constrict first and then dilate because of hypoxia. And one more about hypothermia, cutaneous bully, death due to respiratory arrest of cardiovascular collapse, chronic abuse tolerance. And then I will tell you about diagnosis of barbiturates. So in the diagnosis there are some lab tests, for example TLC, GC or HPLC and EEG. TLC, in TLC we will use urine, stomach contents and seen residue. And EEG alpha comma indicates poor prognosis. And barbiturates treatment. For the treatment of barbiturates, there is a gastric lavage, activated charcoal, forced alkaline diuresis, hemodialysis or hemoperfusion, sportive measures. So this was all about the barbiturates poisoning. Thank you very much. I hope you will like this. Thank you very much.
My name is Mariam Ali. I am from Osh International Medical University. Today my presentation topic is citrizine. Citrazine is an antihistamine medicine that helps the symptoms of allergies. It is used to treat high fevers, conjunctivitis, eczema, reactions of insect bites, some foods allergy. Mechanism of action. Citrazine is a fast action, highly selective antagonist of peripheral histamine receptor. The histamine receptor inhibited by citrizines are primarily on the respiratory smooth muscle cells, vascular endothelial cells, immune cells, and the gastrointestinal tract. First generation antihistamines and dextrolamine cetirizine does not cross the blood-brain barrier to a large extent, avoid the neurons of the central nervous system. Second generation antihistamine cetirizine decrease fluid escaping to tissues from capillaries. Therapeutic use. Cetirizine is safe to treat perennial allergic rhinitis and articular in adults and children over the age of 6 months. It is indicated for treating seasonally allergies in adults and children 2 year elders. Cetirizine is also safe to use in the geriatric population. Contraindication. Cetirizine is contraindication in people with known hypersensitivity to it. In addition, it should not be used currently nerve systems depressed as it can cause dose-related sedations, and cetirizine is not recommended for breastfeeding mothers since it is excreted in breast milk. Cetirizine will be medication, which means that it can be given safely for pregnant women mothers. Side effects of cetirizine. The most common side effects of cetirizine is feeling sleepy and tired. That happens more than 1 in 10 people, and severe side effects of cetirizine are extremely rare, and it can include hypotension, anaphylaxis, hepatitis, and hemolytic anemia.
My name is Michelle Aman. Today my presentation topic is about the levodopa and the carbidopa. Introduction to the levodopa and the carbidopa. Levodopa. The levodopa is the L-dopa or the L34 dihydroxyphenylalanine. It is highly inert. The carbidopa is the inhibitor of the L-aromatic amino acid decarboxylase, which is dopa decarboxylase. The brand name of the levodopa and the carbidopa is the Cinnamate. Its generic name is the carbidopa and the levodopa. Pharmacodynamics mode of action. Levodopa crosses the blood-brain barrier where it is converted into the dopamine. Only 1 to the 3% of the levodopa actually enters the brain unaltered. Addition of the carbidopa lowers the dose requirement of the levodopa, which reduces the peripheral side effect associated with the levodopa alone. Two forms are available. In first form, 1:4 levodopa 100 mg, carbidopa is 25 mg. In the second form, 1:10, the levodopa is 250 mg and the carbidopa is 25 mg. Therapy is started with the smaller dose. Dose is raised gradually. Dopamine agonist can be added. Pharmacokinetics. Absorption. Orally, it is absorbed 64%, distribution plasma proteins binding 36%, plasma peak level is 0.5 to 2 hours. Metabolism metabolized by decarboxylase in gastrointestinal tract and the blood vessels. Excretion it is excreted unchanged in the urine. Renal excretion is 30% while the half life is 2 to 3 hours. Clinical use of the levodopa and the carbidopa. Clinically, the levodopa and the carbidopa is used for the treatment of the Parkinson's disease. The levodopa is generally given in combination with the carbidopa. The carbidopa is a peripheral dopa decarboxylase inhibitor which reduces the peripheral conversion to the dopamine. The start dose is 25 mg of the carbidopa and 100 mg of the levodopa 3 times daily, 30 to the 60 minutes before the meal. The Parkinson's disease is the degeneration of dopaminergic neurons in the substantia nigra. Substantia nigra is the part of the basal ganglia. So when there will be the degeneration of dopaminergic neurons, it results in the deficiency of the dopamine. When there will be the deficiency of the dopamine, there will be the imbalance between the dopamine and ACH. Parkinson's disease is the destruction of the dopamine pathway in the basal ganglia. In Parkinson's disease, there will be the destruction of the substantia nigra to degeneration of nigrostriatal pathway, which reduces the dopamine, so it results in the dopamine deficiency. What are the major symptoms of the Parkinson's disease? The major symptoms are the stooped posture, the back rigidity, forward tilt of the trunk, flexed elbow and the wrist, reduced arm swing, the hand tremors, tremors in the legs, slightly flexed hip and the knees. Adverse effects of the levodopa: nausea, hallucinations, portal hypertension. Dopaminergics, carbidopa and levodopa drug interactions, decreases levodopa effect with the anticholinergics. Phenytoin, tricyclic antidepressants, MAO inhibitors. Phenothiazines, vitamin B6. Thank you.
Nader Hussain in front of you. Today I will explain Parkinsonism and Parkinson disease. So Parkinsonism is a disease, extrapyramidal disease, which is caused due to degeneration of neuron present in the basal ganglia. Actually, basal ganglia is responsible for the balance of acetylcholine and dopamine. So there are some protein which are called synuclein protein, also called the voice body, which begin to accumulate in the basal ganglia. Actually, in basal ganglia, we have different part of basal ganglia and part of basal ganglia, and those part which include putamen, caudate nucleus, globus pallidus, then substantia nigra. So these Levi's body begin to accumulate in the nigrostriatal pathway. So and so nigrostriatal pathway begin to degenerate and they begin to degenerate, and which cause the decreased level of dopamine in the body. So decreased level of dopamine, when there is decreased level of dopamine in the body, then it can lead to rigidity, akinesia, that is bradykinesia, then tremor, then postural reflex, then mask-like face, then impaired postural reflex. So to understand which drugs we have to give in Parkinsonism, then we first of all we have to understand the mechanism of dopamine. Then if we talk about this, so to understand very well, we have to understand that how dopamine is formed. So dopamine is primarily formed by the tyrosine enzyme. So tyrosine enzyme first converting L-dopa, then L-dopa converting to dopamine. In the in peripheral nervous system, dopamine can also form, but the problem is that dopamine cannot cross the blood-brain barrier, and it also can cause orthostatic hypotension and vomiting in the periphery. So to better cure Parkinsonism, we have to convert L-dopa into dopamine in the central nervous system. So there are some drugs which can increase dopamine level in the body. So and dopamine level, to increase dopamine level in the body, we have to give those drugs which can stimulate the precursor of dopamine, which can agonist the receptor of dopamine, which can inhibit the metabolism of dopamine. So first of all, if we talk about the L-dopa, then L-dopa convert into dopamine by the hypophyrin enzyme called dopa decarboxylase. So we have to give those drugs which can inhibit the dopa decarboxylase, so that L-dopa cannot convert into dopamine. So in these category we have carbidopa and levodopa. Carbidopa and levodopa drugs which inhibit dopa decarboxylase. Then there are some other drugs which work on an enzyme called catechol-O-methyl transferase. Then catechol-O-methyl transferase enzyme is responsible for the conversion of L-dopa into 3-orthomethyl dopamine. So when L-dopa cannot convert into 3-orthomethyl dopa, so L-dopa easily crosses the blood-brain barrier. So in this category we have tolcapone and entacapone. Entacapone and tolcapone drugs work on catechol-O-methyl transferase and inhibit the conversion of L-dopa into 3-orthomethyl dopa. Then there are other drugs, and other drugs are called selginine and rasalginine, and these drugs work on monoamine oxidase enzyme. Monoamine oxidase enzyme convert the L-dopa into dihydroxyphenyl acetic acid. So when dopamine can convert dihydroxyphenyl acetic acid, so dopamine level decrease in the body. So we give selginine and rasalginine which inhibit the monoamine oxidase enzyme. So dopamine level increase in the body. So in these three category increase the dopamine level of the dopamine level in the body and can reduce the deficiency of dopamine. Then there are other drugs which can agonist the dopamine receptor, and in these diseases we have rapinol, bronchocriptin. So these diseases are very well known in Parkinsonism. And if we talk about Parkinson's disease, there are some difference. So if the cause of Parkinsonism is idiopathic, then it is called Parkinson's disease. So this is little bit about Parkinson's disease and the mechanism of dopamine and how different drugs can be given in dopamine in Parkinson's disease. So I hope you like this video. Thank you very much.